A blessed day to all of you guys. For this video, I'm going to discuss nursing as a science. And this is actually a continuation of my discussion sa chapter 2, which is the concepts of nursing. Under that chapter, di ba, we have already discussed nursing as a profession and then nursing as an art. So this time, we are going to know naman the concept of nursing as a science. And to start with, we have um, the overview of the nursing process. So when we say nursing process, it is a systematic, rational method of planning and providing individualized nursing care. So again, para tayo ay makapag-deliver ng individualized care sa ating pasyente, we utilize the nursing process. So that is how we deliver the care or service to our patient by doing the nursing process. It is systematic, meaning we follow a step-by-step process or procedure to accomplish the nursing process, and it is rational, meaning we use our critical thinking as a nurse in order to address the needs of our patient. Now, what are the phases of the nursing process? You have assessing, diagnosing, planning, implementing, and evaluating. And that is the order of the nursing process. So, what are the purposes? First, to identify a client's health status and actual or potential healthcare problems or needs. To establish plans to meet the identified needs. To deliver specific nursing interventions to meet those needs. And the client, the client or yung pinagsaservisyohan natin could either be an individual, a family, a community, or a group. So ito yung variations ng ating mga kliyente. So either a single person, pwedeng yung pamilya mismo, or yung buong community, or a certain group of people. So itong purposes na nabanggit ko, you can see or you can realize these purposes of the nursing process as we discuss each phase of the process. Pero in general, the purpose nga of the nursing process is to identify the health care needs of the patient and then to develop a plan in order to address the identified healthcare problem, and then to provide a nursing intervention of the patient or of the clients that we have, so that we can solve kung ano man yung nakita natin problema sa kanya. So, it's a step-by-step process talaga. Identification of the problem, planning, and then nursing intervention in order to address the needs of the patient or the client. Now, we have Lydia Hall here. So, she is the one who originated, or like parang sa kanya nang galing ang term na nursing process in 1995 and introduced 3 steps of nursing process. So this is during her time. So she had 3 steps for the nursing process, which includes note observation, the administration of care, and validation. So, significant na yung naging change sa nursing process. However, the concept or the purpose is the same. That is to provide care to our patient. Okay, so now we are going to talk about the steps of the nursing process. Yung steps na to, ito yung phases na sinabi ko kanina. So let's dive deeper into the nursing process. So for the first step, we have the assessment. This is the first step in nursing process. And it is the process of gathering, verifying, and communicating data about a client. So dito tayo gagather ng data sa ating pasyente. Tapos bine-verify natin definitely yung mga information na nakukuha natin sa ating pasyente. And also, this is communication is very important during the assessment phase. Or sa buong process naman ng nursing, communication is very important. Pero in the assessment phase, definitely ito yung unang encounter natin with the patient. Kaya communication, establishing good rapport to our patient is very important. To have a therapeutic relationship to our patient is also important. Purpose of the assessment to establish database. Ang purpose natin is makakuha tayo ng full details in terms of the health of our patient. During assessment, collection of data by gathering information about the client's physical, psychological, emotional, socio-cultural, spiritual factors that may affect his or her health status. So ito yung mga aspects, ito yung mga um, tinitingnan natin sa ating pasyente when we get his or her information, because these are the things that affects or influences the health status of the patient. Now, what are the types of data? I know you are very familiar with this. First, you have the subjective data. This is what we refer as symptoms. Pag sinabing subjective data, siya rin yung symptoms na tinatawag natin. So, this can be described only by the person experiencing it. So, sa subjective data, ang makakapagsabi lang niyan ay yung taong nakaka-experience niyan, meaning si patient himself or herself. Kung ano yung kanyang nararamdaman, kung ano yung kanyang perceptions, kung ano yung mga information na nakukuha natin sa kanya through our interview, that can be considered as subjective data. Okay? Example is vertigo, such as dizziness. If sinabi niya na he or she felt dizzy, so that is a subjective data. Pain, the pain level of the patient. So we have our own experience of pain kasi, right? So it differ from one person to another. So that is subjective. Tinnitus, such as ringing of the ears and feeling anxious. All of those are subjective data or can be considered as symptoms. On the other hand, we have objective data. So these are the signs. Ito yung signs na nire-refer natin kadalasan. So these are the data that can be observed and measured. Ito yung nakikita natin as a healthcare practitioner. These are the data that can be observed and pwede natin i-measure. So for example, you have pallor. So nakikita natin yung the physical appearance of the patient in terms of the skin, for example. If she looks pale, so that is our objective data. Meaning, ito yung observe mo, nakita mo sa iyong patient. Sweating, if you have, upon your observation or inspection of your patient, for example, nakita mo na he or she is sweating, so that is an objective data. Blood pressure of 120/80. This one is measurable. And that is also an objective data. Di ba, kumukuha tayo ng blood pressure to our patient. So, sa atin ang galing yun. Reddish urine. So, this is something that we can observe or inspect during physical exam or during, for example, a laboratory specimen collection. So, makikita natin siya. Cyanosis, elevated temperature, and skin moisture. So, these are all examples of objective data or yung signs na tinatawag natin. So, yun yung difference ng subjective versus objective, symptoms versus signs. So, I provided here samples pa ng subjective and objective data. So, lahat ng verbalization ni patient, so that can be considered as subjective. So lahat ng may quote-unquote because again, it came from our patient. While yung objective data, ito yung ating nakita, yung ating physical examination techniques, the IPPA. So this can be considered as objective data. So I will leave the rest of the readings to you guys. I included that to my PowerPoint and I'll be sending the presentation to you. So methods of data collection, how do we collect data to our patient? First is through interview. We have, pag sinabing interview, it is a planned, purposeful conversation. Pag sinabing purposeful, meron tayong goal why we conduct interview. And in our case, to help our patient solve or address his or her needs or problems. So we have different types of interview. You have focus interview. Pag sinabing focus interview, you are asking specific questions to your client, meaning you are focused to a certain topic. Pag sinabi naman direct interview, it consists of limited questions, especially in emergency situations. You are directing questions to your client. Direct yung question mo because you want to know a specific answer. Kasi, for example, emergent or emergency yung situation, kaya you need a specific answer. Next, you have observation. It use observation, use of senses, units of measure, physical examination techniques, interpretation of laboratory results. And then letter C, you have physical examination techniques or the IPPA, which includes the inspection, palpation, percussion, and auscultation. So all of these are the ways or methods for us to collect data from our patient. Okay, so to elaborate lang itong sa sa interview under focus and direct. So focus interview, if common to, if for example, si patient ay pumunta sa'yo in the clinic, for example, and then complaining of a certain problem. If that is the case, then yung problem niya, yung pinaka-focus or yung pinaka-gusto mong malaman, right? So, if commonly yun kapag may database na tayo from that patient. So, if that is the case, ang magiging focus na lang natin is yung problem na nire-raise niya sa atin, yung pinaka present complaint niya in that situation or in that case. So you are asking specific questions with regards to the problems that he or she is raising. So not necessarily ito ay can be done in any condition of the patient. Okay? Unlike dito kay direct interview, this one is during an emergency situation wherein you are direct to the point. You are only giving specific questions or limited questions to your patient because you would want to know yung um, specific details nga because the patient is in emergency case or emergency situation. Okay, so that's an additional information for focus and directive interview. So here is an example of um, an interview na nakukuha natin sa ating pasyente. And this is an example of Gordon's functional health patterns. So we have here several aspects in terms of the patient's condition or definitely lahat ng data na to nakuha during the interview with our patient. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. So we have 11 functional health patterns and this is based kay Gordon. So meron tayong specific questions na ina-ask for each health pattern. And I know na this one will be discussed thoroughly in your health assessment subject. So again, this is an organized way of collecting data or assessment to our patient. So this one, again, functional health patterns. So that is the first step, no? We have the assessment. So wherein we collect data, we gather information, and we verify them. Next step of the nursing process is the diagnosis. So when you say diagnosis, it is analyzing and synthesizing data. So tayo ay nagiging critical thinker na, or I mean, as a nurse naman talaga, dapat inherent na sa atin yung pagiging critical thinker natin. Okay, pero this time for the nursing diagnosis, kasi we are analyzing talagang nag-critical thinking tayo to process the data that we have collected during the assessment phase. So it uses critical thinking skills nga to interpret assessment data and identify client strength and problems. A causal relationship between a problem and its related or risk factors. So yun yung yung significance ng diagnosis. Okay, so identify clients, strength and problems, a causal relationship between a problem and its related or risk factors. So, ano yung purpose ni diagnosis? So, to identify client strengths and health problems that can be prevented or resolved, to develop a nursing and collaborative problems. So for the diagnosis, we have nursing diagnosis. So we are specific here. Since we are nurses, definitely, ang sa ating part is nursing diagnosis. So when you say nursing diagnosis, it is a statement of nursing judgment and refers to a condition that nurses, by virtue of their education or our education, experience, and expertise, are licensed to treat. Okay, so ito yung judgment na nga natin. So ito yung ating batay sa ating critical thinking na ginawa na talagang we are licensed to treat to our patient or with our patients. So ito yung tulong na ibibigay natin sa kanila in terms of addressing their health problem. Okay, so ito talaga yung license tayo para matreat yung kanilang health problem. And as we go along, makikita ninyo ano-ano ba yung mga nursing diagnosis na pwede na sinasabi ko. It described the human response, a client's physical, social-cultural, psychological, and spiritual responses to an illness. So ito yung mga aspect ni patient na pwede nating gawan ng nursing diagnosis. Let's compare nursing diagnosis to a medical diagnosis. So when you say medical diagnosis, it is made by a physician, meaning a doctor, and a medical doctor, and refers to a condition that only a physician can treat. So kung tayo, what we can treat is what we can address is our nursing diagnosis. Sa mga physicians naman or doctors, ang kanila naman na tinitreat is their medical diagnosis from their patients. It refers to disease processes, specific pathophysiologic responses that are fairly uniform from one client to another. So, this is, again, pag sinabing medical diagnosis, it is the disease process of the patient. So, yun yung difference no ni nursing diagnosis versus medical diagnosis. Definitely, our concern here is the nursing diagnosis. So, based on the data collected, identify a nursing diagnosis from NANDA International or NANDA-I. So, NANDA is an evidence practice literature. Pag sinabing NANDA pala, NANDA, it means North American Nursing Diagnosis Association. Pag may I, I is for international. So, in this case, pag sinabing NANDA, ito yung organization na nagko-collect ng data to identify a nursing diagnosis. So, sila yung nagko-collect ng mga nursing diagnosis identified sa buong mundo. Okay, in that sense. So we have here the purpose of NANDA International to define, refine, promote a taxonomy of nursing diagnostic terminology of general use to professional nurses. So very helpful yung kanilang book or yung kanilang collection of nursing diagnosis because it really guides us nurses in performing the nursing process. So, ano ba yung taxonomy? Kasi nga, di ba, kinokollect ni Nanda yung mga nursing diagnosis already identified. Tapos, ginagawa niyang standard or ini-standardize niya para it can be used by all healthcare professionals, meaning nurses, no? All over the world para iisa lang yung tinitingnan natin. So when you say taxonomy, it is a classification system or set of categories arranged based on a single principle or set of principles. So in this case, we have the Nurse's Pocket Guide. Ito yung ginagamit natin na taxonomy or nursing diagnosis na ginawa ni NANDA International or ni NANDA themselves. So collection na yan ng mga dapat nating gawin sa nursing process. That includes the nursing diagnosis, tapos yung mga assessments na pwede nating makita to our patient. And then it also includes planning, nursing interventions, and evaluation. So lahat-lahat na kailangan natin in the performance of the nursing process, makikita natin dito. So it's advisable that you buy your own book, such as this one, Nurse's Pocket Guide. So may PDF din naman yan, you can secure a copy. So parang it's like our Bible as a nurse to have that NANDA book. Now, the status of the nursing diagnosis, we have actual diagnosis. Pag sinabing actual diagnosis, it is a client problem that is present at the time of the nursing assessment. So, pag sinabing actual diagnosis, ito yung mga nursing diagnosis natin na nangyayari kay patient or client presently. Okay? So, for example, si client ay nakaka-experience ngayon ng ineffective breathing pattern and anxiety so that it can be considered as actual diagnosis. Next, we have health promotion diagnosis naman. It relates to the client's preparedness to implement behaviors to improve their health condition. So, preparedness ni patient naman pagka health promotion diagnosis. An example niyan, readiness for enhanced nutrition. So, parang naiba lang yung term, di ba? Preparedness to readiness. So, ayan. And then we have the risk nursing diagnosis. So, it is a clinical judgment that the problem does not exist, but the presence of risk factors indicates that a problem is likely to develop unless nurses intervene. So, pag sinabing risk nursing diagnosis, so hindi pa siya nade-develop kay patient, hindi pa siya nangyayari, pero there is a possibility na ma-develop siya, mangyari siya, unless as a nurse, we intervene para hindi siya totally mangyari or ma-develop. So at risk pa lang si patient of developing such diagnosis. Example ni risk nursing diagnosis, all people admitted to hospital have some possibility of acquiring an infection. So, syempre, that is a hospital. So, there's a possibility na magkaroon tayo ng infection yung mga bumibisita doon sa hospital. However, a client with diabetes or compromised immune system is at higher risk than others. So definitely mas mataas yung risk na may infection yung mga immunocompromised patient natin or for example, yung may comorbidity such as diabetes. So they are at higher risk. Therefore, the nurse would appropriately use the label risk for infection to describe the client's health status. So, pwede natin gamitin yon if that is the case of our patient. Okay, so the nursing diagnosis is, in that case, is risk for infection. So these are the status of the nursing diagnosis. It can either be actual, meaning present yan, health promotion, this refers to the preparedness of the patient. And then you have the risk nursing diagnosis. Ito ay likely to develop pa lang. Next, components of NANDA nursing diagnosis naman tayo. So ano-ano ba yung components ng nursing diagnosis? First, you have problem or diagnostic label and definition. So it describes the client's health problem or response for which nursing therapy is given. So that is a problem and definition. So meaning it is the client's health problem. So the purpose of the diagnostic label is to direct the information of client goals and desired outcomes. To be clinically useful, diagnostic labels need to be specific. So when the word specify follows a NANDA label, the nurse states the area in which the problem occurs. For example, deficient knowledge, such as um, due to the area of medications, for example. So another one, deficient knowledge in terms of what? Dietary adjustments. So another, we have here what we call qualifiers. These are words that have been added to some NANDA labels to give additional meaning to the diagnostic statement. For example, you have deficient. So that is a qualifier, yung term na deficient. So when you say deficient, it means inadequate in amount, quality, or degree, or pwede rin incomplete. Another example of a qualifier is impaired. So when you say impaired, made worse, weakened, damaged, reduced. Decrease, it means lesser in size, amount, or degree. Ineffective, not producing the desired effect. So these are the qualifiers na madalas nating ginagamit in formulating our nursing diagnosis. So that is the first component of the nursing diagnosis. So you have here a problem and the definition of the problem. Okay, so that is the client's health problem. Next, after that component, when you identify already ano ba yung problem ng patient, we have here, by the way, sa problem, gumagamit nga tayo ng qualifiers such as ineffective, impaired, etc. The next component is etiology. When you say etiology, ito yung related factors and risk factors. So, again, pag sinabi etiology, ito yung mga related na factors kung bakit na-develop yung problem sa ating pasyente. Ito yung risk factors niya kung bakit siya nagkaroon ng problema. So it identifies one or more probable causes of the health problem, gives direction to the required nursing therapy, and enables the nurse to individualize the client's care. Example of an etiology, you have your activity intolerance. So that is the problem identified, activity intolerance. So ano yung causes? Bakit siya nagkaroon ng activity intolerance? That would be the etiology, di ba? Or the related or risk factors. So ang causes ng activity intolerance include generalized weakness, sedentary lifestyle, and so on. Meaning, nagkaroon siya ng activity intolerance dahil siya ay may generalized weakness, sedentary lifestyle, and others. So, these are the risk factors. Okay? Kung bakit pwede siya magkaroon ng activity intolerance. So, after that, number 3, you have the defining characteristics. So, these are the clusters of signs and symptoms that indicate the presence of a particular diagnostic label. So, ito yung mga signs and symptoms na discuss natin kanina. Ito yung subjective and objective data, which parang nagbibigay pa ng description or defining characteristics nga to our problem. So for actual nursing diagnosis, the defining characteristics are the client's signs and symptoms. So pag actual, yun na mismo yun, the signs and symptoms of the patient kasi actual na siya, nangyayari siya presently. So meron tayong subjective and objective cues talaga. Whereas for risk nursing diagnosis, there are no subjective and objective signs pa. Kasi nga, risk pa lang. Hindi pa siya nangyayari, kaya wala ka pang mailalagay na signs and symptoms or subjective and objective data. Okay, so yun yung tatlong components of the nursing diagnosis. You have the problem, etiology, and the defining characteristics. Now, I have here an example para mas maliwanagan tayo of those components. So again, the three components are diagnosis and definition, related factors, and defining characteristics. So commonly, makikita nyo yan sa NANDA book. Okay, looking for your nursing diagnosis. So for example, we have here as our diagnosis na activity intolerance. So merong definition doon si Nanda provided already what is an activity intolerance. So the definition is insufficient physiological or psychological energy to endure or complete required or desired daily activities. So that is the first component of NANDA. Yung diagnosis at saka yung definition niya. Now, we have the related factors. Pag sinabing related factors, ito yung mga naging risk factors ni patient. Ito yung mga probable causes. Why nagkaroon siya ng problem na yon or yung diagnosis na to. So the related factors are bed rest or immobility, generalized weakness, imbalance between oxygen supply or demand, and sedentary lifestyle. So these are the related factors na pwede nating piliin based on our activity intolerance. So pipili ka lang dyan kung ano yung applicable to your patient. So siya ba ay because bed rest or siya kasi ay naka-immobilize kaya siya nagkaroon ng activity intolerance? Baka siya ay may generalized weakness or sedentary kasi yung lifestyle niya or imbalance between oxygen or supply and demand. So again, you will just pick the related factors applicable to your patient. So kung ano yung lumalabas sa kanya talaga or kung ano yung meron siya talaga, yun yung kukunin nyo. We should give an individualized care to our patient. Remember that. And then for the defining characteristics, ano yung mga objectives and subjective cues. For example, the patient verbal report of fatigue or weakness, abnormal heart rate or blood pressure. So the first one is subjective, the second one is objective. Electrocardiographic changes, this one is objective, and exertional discomfort or dyspnea. So ito, pwede itong we can observe kung talagang hirap na hirap huminga si pasyente. So this could be an objective cue. So these are the components of a nursing diagnosis. So I hope na clear sa atin ito. So now we are going to formulate diagnostic statements. So in formulation of diagnostic statements, we have first the basic two-part statements. So for the basic two-part statements, you have the PE. First, you have, kaya siya two-part. The first part is problem, second part is etiology. So parang yung kanina, itong components na discuss natin. So ito lang yung format na pwede natin gamitin in formulating your diagnostic statements. So yung pag basic two-part, you have part 1 problem, the second part is etiology. Yung problem, ito yung kaninang sinabi natin, statement of the client's response. NANDA label, makikita nyo yan sa NANDA. Kung ano man yung list of problem doon na applicable to your patient. And then etiology, again, pag sinabi etiology, these are factors contributing to or yung probable causes of the responses. So two parts are joined by words related to. So yung problem at saka etiology, they are parang connected or joined by the words related to. So in this example, ito si problem, ito si etiology. So two-part siya. Pag nabuo yan, meron ka ng nursing diagnosis. Example, constipation. Bakit siya nagkaroon ng constipation? That is related to prolonged laxative use. So, ibig sabihin, nagkaroon siya ng constipation because of prolonged laxative use or related to prolonged laxative use. So, problem, ito yung na-identify na problem sa iyong pasyente, like your nursing diagnosis related to, ito yung term na pinag-connect natin sila, and then etiology, ito yung probable cause nga or the contributing factor or the risk factor. Another example, anxiety related to threat to physiological integrity. So that this is a part, this is a basic two-part statements. First part is problem, second part is etiology. Next, we have the basic three-part statements. So yung kanina ay two, ito naman ay tatlo. May nadagdag lang sa PE kanina. We have signs and symptoms or S. So P ganun pa rin. E ganun pa rin. And then yung pang-third na nadagdag lang sa ating three-part statements is the signs and symptoms. So, pag sinabing signs and symptoms, ito yung defining characteristics na na-discuss natin kanina as the component of the NANDA. So, parang yun lang din, itong three-part statements natin. Yung kanina, component in NANDA, the problem, the etiology, and the signs and symptoms. So, it's just like the same. So, for the three-part statements, you have kasi dito, pino-formulate na natin yung statement na gagamitin natin for our nursing diagnosis. So, signs and symptoms, again, this is the defining characteristics manifested by the client. Ito yung nakita or sinabi ni patient sa'yo. So, okay na tayo, na-discuss ko na to kanina. So, subjective and objective cues or data yan, pag signs and symptoms. So, this is an example of a three-part diagnostic statement. So, parang yung two-part, ito na siya, dadagdagan lang natin ng signs and symptoms. At yung term na ginagamit natin para maidagdag si signs and symptoms is as manifested by or AMB. So, para mag-connect si problem and etiology, gumagamit tayo ng related to. Para naman mai-connect si signs and symptoms, gumagamit tayo ng as manifested by. Okay, for example, situational low self-esteem related to feelings of rejection by husband as manifested by hypersensitivity to criticism. For example, nagsabi siya na, I don't know if I can manage by myself and rejects positive feedback. Ayun yung mga signs and symptoms na nakuha natin to our patient. Okay? So this one is a three-part diagnostic statement. So nagkaroon tayo ng signs and symptoms. So I will be sending you another video of my discussion on how to create an NCP, and under that kasi nakaka-discuss din sa akin kung paano gumawa ng nursing diagnosis. So I will just, for your additional information lang yun, for your additional guidelines. Okay, and then the third type in or like formulating your diagnostic statements is you have the one-part statements. So for one part, diagnostic statements such as health promotion diagnosis and syndrome nursing diagnosis, it consists of a NANDA label only. So ito lang yung one-part statements natin. Either health promotion diagnosis or and syndrome nursing diagnosis. So currently, we have 7 syndrome diagnoses. Okay, based on the NANDA International List. So, for example, risk for disuse syndrome may be experienced by long-term bedridden clients. So, clustered of diagnoses associated with this syndrome include, so ito na yung mga pwedeng nursing diagnosis. So, again, risk for disuse syndrome. So, since syndrome diagnosis siya, we have here the different clusters of diagnosis na pwede nating magamit. Okay, so this is a one-part statement nursing diagnosis. So either health promotion yan or syndrome nursing diagnosis. And then I have here the guidelines for writing a nursing diagnostic statement. So please be guided. This is for your additional reading na lang. This is for your information. Okay, and then after our discussion of the first two nursing process, you have the assessment and nursing diagnosis. Now we proceed with the planning. So planning, we have the types of nursing interventions. Independent interventions, these are the activities that nurses are licensed to initiate on the basis of our knowledge and skills. So ito yung mga interventions or activities na pwede natin gawin independently without any orders from anyone or without any notification from anyone. So ano yung mga independent example, physical care, yung pag-care natin, nursing intervention physically to our patient within our scope of practice. ongoing assessments, emotional support and comfort, teaching our patient, counseling, among others. So ito yung independent interventions, meaning you can perform without physician's order. Okay, um, by experience and by our education, ito yung we can perform talaga on our own. Dependent interventions, these are activities carried out under the orders or supervision of a licensed physician or healthcare provider authorized to write orders to nurses. So ito yun na nga, yung mga order ni doctor sa atin as a nurse para makatulong sa paggaling ng pasyente such as ang pagbibigay ng medication among many other dependent interventions na pwede natin gawin to our patient. Again, um, binibigay yung order na yan ni doctor or other healthcare provider na authorized na magbigay sa atin ng direct order. Next, you have collaborative interventions. These are actions that nurse carries out in collaboration with other health team members. So ito yung pakikipag trabaho natin with other healthcare team, which includes physical therapists. For example, kailangan ma-refer ni patients sa isang physical therapy, social workers, dietitians, and primary care providers. So yun naman yung collaborative interventions, meaning we are collaborating the care of our patient to other providers. So these are the types of nursing interventions. Now, I have here the nursing care plan format. Pinakita ko lang. So you have the defining characteristics, nursing diagnosis, tapos na tayo dyan, desired outcome or goals. So this is part of our planning. Nursing intervention, rationale, and evaluation. So this is the general format. So as it depends on your institution or nursing school kung ano yung NCP format na ginagamit ninyo. So what is planning? It is a deliberative, systematic phase of the nursing process that involves decision making and problem solving. So the nurse refers to the client's assessment data and diagnostic statements for direction in formulating client goals and designing the nursing interventions. So nakakapagplano lang tayo kapag meron na tayong assessment and nursing diagnosis. So binabasa natin yung plano natin base doon sa nakuha natin or na-formulate nating assessment and diagnosis. So yung planning, it begins first client contact and continue until the nurse-client relationship ends. So nagsisimula na yung planning natin sa unang contact pa lang natin with our patient and natatapos siya until um, our nurse-client relationship ends. Or usually when the client is discharged from the health care agency. So pagka na-discharge na si patient, so planning also ends. Purpose kasi na-reach na natin or na-perform na natin yung gusto natin mangyari kay patient if na-discharge na siya, definitely. So purpose of that is to identify the patient's problem. So we have types of planning. Initial planning. So ito ay the nurse who performs the admission assessment usually develops the initial comprehensive plan of care. Initial meaning ito yung unang plano or ito yung initial encounter natin. Initial yung parang unang pagpaplano natin based on the um, initial comprehensive plan of care from our patient. So it should be initiated as soon as we have the initial assessment. So kapag meron na tayong baseline data, we are conducting planning and that is initial planning, meaning paunang plano pa lang. So that is initial. Ongoing planning naman, all nurses who work with a client do ongoing planning. So usually ongoing assessment data, the nurse carries out daily planning for the following purposes. So these are the four purposes to determine whether the client's health status has changed, to set priorities, to decide which problem to focus, and to coordinate the nurse's activities so that more than one problem can be addressed. So basta kapag tayo ay nakikipag transact pa rin with our patient at we are providing care pa rin with our patient. So, ongoing pa rin yung planning natin as hangga't meron tayong nurse-client relationship. So, that is an ongoing planning. And then discharge planning. So, this is the process of anticipating and planning for needs after discharge. So, tinitingnan na natin ano ba yung mga kakailanganin ni pasyente after niya ma-discharge. Ano ba yung mga health teachings or education na kailangan niya. So, this is crucial part of a comprehensive healthcare plan and should be addressed in client's care plan. So, pati yung discharge niya, meaning yung paglabas siya ng hospital, pinaplano natin yon, such as health teachings na binibigay natin. So, developing nursing care plans, the end product of planning phase of the nursing process is a formal or informal plan of care. So, pag sinabing informal nursing care plan, ito yung nasa isip lang ng nurse. Strategy or action na naiisip pa lang ng nurse. That is informal. Kasi nasa mind pa lang. Formal nursing care plan yan kapag written na or computerized guide that organizes information about the client's care. So, formal nursing care plan, yan na yung documented mo. Naisulat mo na or electronically record mo na siya. So, we have two types under formal nursing care plan. Could be either standardized care plan. Ito yung formal plan that specifies the nursing care for groups of clients with common needs. Meaning, ito yung gagawin natin, for example, to all patients who have diabetes mellitus. So, standardized siya. Okay? Ito yung gagawin natin to all clients with myocardial infarction. So, standardized. Whereas, pag individualized naman, tailored siya to meet the unique needs of a specific client. So, ibig sabihin, individualized yung um, plano na binibigay natin kapag kinoconsider natin yung condition mismo ni pasyente. So, ito yung mga needs na hindi ma-address ng standardized plan. Okay, so these are the two types of formal nursing care plan. Could either be standardized or individualized. So definitely, si standardized, it serves as a guide for us. Pero ang mahalaga is yung individualized care plan because we give naman, di ba, individualized care to our patient to address their needs. Now, establishing client goals or desired outcomes. So, goals, desired outcomes describe in terms of observable client responses with what the nurse hopes to achieve by implementing the nursing interventions. So, when you say NOC, makikita niyo to sa NANDA book. It is a taxonomy for describing client outcomes that respond to nursing interventions. Okay, so ito yung mga, these are the lists na nagde-describe ng outcome or yung, kumbaga, yung gusto natin makita to our patient. Okay, so in response to our nursing interventions, in response sa ginawa natin sa kanila. Ito yung mga gusto natin makita after providing the necessary care to our patient. Now, purpose of goals or desired outcomes to provide direction for planning. Nursing interventions serve as criteria for evaluating client progress, enable the client and nurse to determine when the problem has been resolved and help motivate the client and nurse by providing a sense of achievement. Goals may be short-term or long-term. So yung goal natin or the yun na nga, parang like planning can either be a long-term or a short-term plan, long-term or short-term goal. So here is an example of a desired outcomes based on the nursing diagnosis that we have identified. Okay, so ito yung mga opposite healthy responses. So ito lang yung pag sinabing opposite healthy responses, ito yung kabaligtaran ng nursing diagnosis na na-notice natin. For example, impaired physical mobility, which is the inability to bear weight on left leg related to inflammation of knee joint. So ano yung opposite niya? Improved mobility. So kung yung diagnosis mo is impaired, ito definitely yung opposite is improved mobility. Ano yung desired outcomes natin diyan? Ano yung gusto nating makita sa ating pasyente after the nursing intervention? Ambulate with crutches by end of the week. Stand without assistance by end of the month. So, that is an example of an outcome, yung desired outcome na gusto natin makita sa ating pasyente. Okay, so I hope clear doon. So that is the third component of the um, nursing process. So the fourth one, you have the intervention. So nursing interventions and activities are the actions that a nurse performs to achieve client goals. So ito yung ginagawa natin sa ating pasyente para ma-meet yung plano na kinraft natin kanina. Okay, para ma-address yung needs ni pasyente. So nursing interventions, so ayan, purpose natin is to assist the client to meet the desired goals or outcomes, promote wellness, prevent illness and disease, and restore health. Kung kanina we have NOC, nursing outcome, um, what's that? Nursing outcome classification, NOC. We have now NIC. Pag sinabing NIC, this is the nursing intervention classification. A taxonomy developed by Iowa Intervention Project was first published in 1992 and it is updated every 4 years. It consists of 3 levels, level 1 domains, level 2 classes, and level 3 interventions. So this serves as a guide then um, na pwede nating gamitin to our patient when we are crafting our nursing interventions. So list of ano yan, actions na pwede natin gawin to our patient to meet our desired goals. So we have types of nursing interventions. Kung kanina we have types of planning, and now we have types of nursing interventions. So when we say independent interventions, so this one, ito yung ano, itong types of nursing interventions, ito pala yung isingit na slide kanina sa planning. So supposedly yung types of nursing interventions kanina na bago ko i-discuss yung planning, dito dapat siya. Okay, so naisingit lang yung interventions doon, pero it is part of the intervention uh, process, okay? As part of the nursing process. So, nasabi ko na to kanina, yung types of nursing interventions, yung independent nursing interventions, ito yung mga pwede natin gawin as a nurse independently without any orders from the physician or from any other healthcare provider. So, ito yung talagang ginagawa natin by all means as a nurse. Dependent interventions naman, ito yung ginagawa naman natin ng may doctor's order. Okay? Ito yung ginagawa natin na may prescription or notification from a medical uh, doctor or any other healthcare provider na authorized na magbigay sa atin ng order. And then interdependent interventions, ito yung collaborative interventions na ginagawa natin sa ibang with other healthcare providers such as physical therapy, social workers, dietitians. So, ito yung nasabi ko kanina. Okay? Sige, let's continue. So, that is that is part of the nursing interventions. Now, a part of intervention pa rin, we have health education. It is defined as developing and providing instruction and learning experiences to facilitate voluntary adaptation of behavior conducive to health in individuals, families, groups, or communities. So dito, basically, tinuturuan natin si pasyente in terms of their condition, in terms of how they can promote their health. Okay, so nagbibigay tayo ng instruction or learning experiences para mapabuti yung kanyang pangangatawan or yung kanyang kalusugan para hindi na siya maulit na ma-ospital or para hindi na ulit yung problema na na-incur niya It is a higher level nursing skill that requires education to efficiently and effectively accomplish goals. So that is part of the nursing, and that is intervention, nursing intervention. So ito yung mga ginagawa natin sa ating pasyente para definitely ma-achieve natin or I mean, ma, makita natin or magawa natin yung plano na dinassign natin kanina para ma-achieve natin yun. So, nursing intervention. And then, finally, we have the evaluation. Okay, so evaluating or evaluation. To evaluate is to judge or to appraise. So, evaluating is the fifth phase of the nursing process. The nurse determines the client's progress toward goal achievement and the effectiveness of the nursing care plan. So, dito, tinitignan natin kung effective ba yung binigay nating intervention, epektibo ba yung naging response natin or yung naging respond ni pasyente sa binigay nating care sa kanya. So the plan may be continued, modified, or terminated. So yung ginawa nating plan, it can either be continued kung um, may progress tapos pero hindi pa tapos yung care natin to our patient. It can be modified kung meron tayong nakitang dapat baguhin with the plan or with the intervention, and can be terminated kung, for example, hindi naman siya applicable, or kung, for example, goal met na-address na natin yung problem. So, evaluation determine if goals and expected outcomes are achieved. So, nalalaman natin dito kung na-meet ba natin yung mga sinet natin sa plano natin. So, it can either be planned, ongoing, purposeful activity in which clients and healthcare professionals determine the client's progress towards achievement of goals and outcomes or the effectiveness of the nursing care plan. So that definitely this is the last part of the the nursing process kasi nga this is where we judge kung okay ba yung nagawa natin sa ating pasyente. Purpose is to determine whether to continue, modify, or terminate the plan of care. So conclusions drawn from the evaluation to determine whether the nursing intervention should be terminated, continued, or changed. So how do we evaluate? So we collect data related to outcomes, compare data with outcomes, relate nursing actions to client goals or outcomes, draw conclusions about problem status, continue, modify, or terminate the client's care plan. Okay, so that is for the um, evaluation. Now we have types pa rin na evaluation. So parang yung sa planning lang din, ano? So you have planned, you have ongoing, and purposeful. So pag planned, this is detailed scheme, program, or method worked out beforehand for the accomplishment of an object, systematic arrangement of details, meaning siya, structured siya. Okay? Talagang pinlano siya. Ongoing naman, assesses whether the relevance is still as expected or if there are changes in the program. Purposeful naman, practices help teachers and students understand where they have been, where they are, and where they might go next. So these are the types of evaluation. And then, ito lang so after we are done now with the nursing process already. So you have 5 phases of the nursing process. You have the assessment. Ito yung ADPIE na tinatawag. You have the assessment, you have the diagnosis, planning, intervention, and evaluation. So, part kasi ng nursing process is the documentation. So, I will be discussing now documentation. So, pag sinabi nating discussion, it is an informal, oral consideration of a subject by 2 or more healthcare personnel to identify a problem. So, meaning you are discussing or you are talking to 2 or more other healthcare professional. So, that is discussion. Pag sinabing report, it can either be oral, written, or computer-based communication intended to convey information to others. So, again, pwedeng pasulat, pwedeng pasalita, or through computer. So for instance, nurses always report on clients at the end of a hospital work shift. So definitely mas formal yung report in comparison to discussion. Kasi discussion, nag-uusap lang kayo, di ba? Um, you are like strategizing kung ano yung gagawin nyo. Pag report naman, eto, you communicate, tapos purposeful yung ating pag-uusap din, definitely, parang nire-relay natin kung ano yung nangyari to our patient at the end of the shift, for example. Okay, so pagka-report, parang ano lang to, brief lang siya because you're just giving the important details. Pagka-discussion, it could either be long kasi parang gusto natin makuha yung full details when we are discussing, right? Now, a record naman, also called a chart or client record, is a formal legal document that provides evidence of a client's care and can be written or computer-based. So pag sinabing record, this is the patient's chart or client record. Definitely formal yan kasi um, structured siya and that is planned and it involves process. And then legal document, yung remember that legal document, yung ating patient's chart can be used as or for legal basis or implications. So you have to take note of that. That is very important. Patient's chart should not be taken too lightly. Pag gagawa ka dyan or mag-patient's chart ka, that is, remember na essential yung mga ilalagay mo. Okay, so the process of making an entry on a client record is called recording, charting, or documenting. So basta mag-insert ka ng iyong chart sa patient or information doon sa client's record, you are recording, you are charting, or you are documenting. So yun yung process. Purposes of client records documentation, communication, planning, patient care, auditing health agencies, education, reimbursement, legal documentation, healthcare analysis. So I will leave the rest of the purposes of documentation to you guys. So kindly read na lang thoroughly what are the purposes of documentation. Mahalaga rin na malaman nyo. Although napasadahan ko naman na like it's a legal document, it is used for reimbursement, it serves as communication, for education. So yun yung mga common purposes kung bakit tayo nagdo-document. Okay, now, let's talk about the documentation systems. Ano-ano ba yung systems na meron tayo or available in the hospital in our documentation? Ibig sabihin, paano ba tayo patient's chart? Paano tayo the document ng ating care given to our patient? So we have the SOR or source-oriented record. This is the traditional client record. So each person or department makes notations in a separate section or sections of the client's chart. So pag traditional client record, meron kanya-kanyang separate na section yung mga bawat department ng hospital. For example, sa admission department, meron siyang admission sheet. Primary care provider, merong physician's order form, physician's history sheet, and progress notes. Sa nurses naman, merong nurses notes. And other departments, they have their own records. So, ibig sabihin, depending on your department, meron kang section doon sa patient's chart. Okay? And that is source-oriented record. So, meaning, oriented siya kung saan nanggaling yung record na to. So, these are the components of the source-oriented record. Pwedeng, sa admission, these are the information na pwede nating makuha sa admission or face sheets. And then for initial nursing assessment, ayan, alam niyo na yan. Graphic record, so ito yung mga vital signs. Daily care record, so ayan. Ito pa yung other forms na meron tayo for source-oriented record. Okay, so meaning, depending on the source, kung kanino nanggaling yung information or yung details. So under source-oriented, we have narrative charting. So again, Since traditional, since source-oriented, we have a narrative charting. So narrative charting is a traditional part of the source-oriented record. So it consists of written notes that include routine care, normal findings, and client problems. So there is no right or wrong order to the information, although chronological order is frequently used. So pag narrative charting, parang tayo ay nagda-diary lang kung ano yung mga care na binigay natin to our patient. Usually, um, in chronological order siya or based sa time na pangyayari. So for example, 7 to 3 p.m. yung shift mo. So definitely, yung charting mo dyan is from 7 to 3 yung order. Okay, yung timing. So, ano yung nang transpire during your shift, nire-record mo lang. That is a narrative charting. So this is an example. And again, I will show you or I will send to you my video discussion on how to document or how to write a narrative charting. So I have a separate video for that and I will send that to you. Pag narrative, again, nagna-narrate ka lang or parang gumagawa ka lang ng entry sa diary mo kung ano yung nangyari for today. So that is narrative charting. So this one is an example of a narrative note or chart sa EHR, sa ating electronic health record ni patient. Pag EHR, we use computer system to, computer-based, meaning high-tech or gumagamit sila ng nursing informatics. So, technology-driven sila kapag EHR. So, ito yung example ng narrative nila. So, this is an example sa other country. Next, if you have source-oriented medical record, we have also a problem-oriented medical record or POMR. So problem-oriented medical record is established by Lawrence Wade in 1960s. The data are arranged according to the problems the client has rather than the source of information. So ito yung comparison niya with the source-oriented. Pag problem-oriented, ang focus natin is yung problema ni patient, not the source of information. So, members of healthcare team contribute to the problem list, plan of care, and progress notes. So, lahat ng team or lahat ng healthcare provider, they can contribute sa problem list. So, plans for each active or potential problem are drawn up and progress notes are recorded for each problem. Advantages of POMR: it encourages collaboration kasi nga any healthcare provider can give their problem list in the front of the chart, alert caregivers with the client's needs, and makes it easier to track the status of each problem. Pag POMR kasi nakalista sa front of the chart yung mga list, yung ano nga, yung problems identified kay patient. Ano naman yung disadvantage ni POMR? Caregivers differ in their ability to use the required charting format. It takes constant vigilance to maintain an up-to-date problem list. And it is somewhat inefficient because assessments and interventions that apply to more than one problem must be repeated. For POMR, we have four basic components. You have database, problem list, plan of care, progress notes. Additional forms na pwedeng magkaroon si POMR, it includes flow sheets, discharge notes. Yung mga flow sheets, ito yung mga INO natin, what else, yung mga medication sheets natin or TPR sheets natin. Okay? So, tingnan natin yung four basic components ng problem-oriented medical record. So, first, you have the database. Pag sinabing database, consists of all information known about the client. So, ito yung lahat ng information na nakuha natin kay patient during the interview and during the inspection or physical exam. So, database, again, ito yung subjective and objective data na nakuha natin kay patient overall. Pag sinabing problem list, derived siya from the database. Nanggaling siya definitely sa assessment or sa initial information na nakuha natin kay patient, either subjective man yan or objective. Usually kept at the front of the chart and serves as an index to the numbered entries in the progress notes. So again, these are just the list or yung mga problemang na-identify natin kay patient. So, primary care providers, right, problems is medical diagnosis. So, yung mga doctor, they have their own, yung problem nila, it is written as medical diagnosis, surgical procedures or symptoms. Whereas sa mga nurses, tayo nurses, yung problem, we write them as nursing diagnosis. So, ito yung na-discuss natin kanina. Plan of care, so ito yung initial list of orders or plan of care made with reference to the active problems. So, ang basis natin sa pag-craft ng plan of care is definitely yung sa nag-gather nating data from our patient. Okay, so ito yung mga problems na nakuha natin. So, out of the problem and nursing diagnosis, doon tayo palang makakapag-create ng plano kung ano pwede natin gawin para ma-address yung needs na to. So, primary care providers, they write their plans sa physician's orders or medical care plans. Sa atin naman nurses, we have the nursing care plans. So, yun yung difference. Progress notes, chart entry by all health professionals involved in a client care. So, they all use the same type of sheets for notes. So, progress notes are numbered to correspond to the problems, and the problem list may be lettered for the type of data. So, progress notes, ito yung mga ginawa nating care sa ating patient. So, ito yung mga interventions, ito yung mga entry na nilalagay natin na sa patient's chart. Ito yung mga ginawa natin sa kanya. Okay? Ito yung mga care or interventions na ginawa. So, progress notes. So, those are the components of the POMR. To discuss progress notes, so we are going to be specific ngayon sa progress notes. Kasi we have different formats of progress notes depending on the agency or the institution na pinagtatrabahuan kung ano yung ginagamit nila for their progress notes. So first, you have the SOAP or SOAP. So SOAP format is frequently used, the acronym for Subjective, Objective, Assessment, and Planning. So SOAP, again, it is the acronym for the acronym for SOAP is S for a subjective, O for objective, A for assessment, P for plan. Subjective, ito yung discuss natin kanina na galing kay patient. Objective, ito yung nakuha mo objectively. Assessment ngayon, ito yung interpretation or conclusions drawn about the subjective and objective data. Meaning, ito yung problem na na-identify mo. So, base doon sa subjective and objective cues or subjective and objective data mo, ito ngayon yung statement of your problem. Okay? So, ito yung na-identify mong problem. So, that is assessment. Plano naman, ito yung definitely your plan of care designed to resolve the stated problem. So, plano, ito yung magagawin mong hakbang para ma-solve itong assessment, which includes the problem that you have identified. Okay, so that is the SOAP. And this is an example of a SOAP in, again, electronic health record. So, subjective, objective, and then yung assessment, ito yung problem na na-identify base dito sa subjective and objective data. So, the assessment here is altered comfort, such as because of the pruritus, the etiology is unknown. Hindi alam yung cause ng pruritus or ng altered comfort probably. So, ayun, dito again, yung altered comfort is because of the pruritus. The etiology of the pruritus is not yet identified. Okay, unknown pa yung etiology nun. And then yung plan, ano yung plano ngayon? Instruct to not scratch skin, apply calamine lotion as needed, trim fingernails. So meaning these are the mga gagawin mong actions to solve the problem na identified. So that is the SOAP format in EHR. So after SOAP, meron tayong modifications ng SOAP. Pwedeng SOAPI or SOAPier. So sa SOPI, nadagdag yung ating I, E, and R. So I is for interventions, E is for evaluation, R is revision. So interventions refer to the specific interventions that have actually been performed by the caregiver. So ito yung iniisa-isa mo kung ano yung mga ginawa mong nursing care sa pasyente. Evaluation, ito yung judgment mo, di ba? That includes clients' responses to nursing interventions and medical treatment. So this is primarily reassessment data. So did you evaluate or gina-judge mo kung goal met ka ba, goal unmet, or goal partially met? Revision reflects care plan modifications suggested by the evaluation. So, um, kung merong kailangang palitan, so you revise based on your evaluation. Ito yung mga care plan modification, that is revision. So, ayun yung SOPI, tsaka SOPIER. So, IER yung nadagdag. And then, after that, so we are done with the source-oriented record, and then problem-oriented medical record. So in problem-oriented medical record, we have discussed the components already. We have the database, problem list, what else? Yung ating plan of care and the progress notes. Na-discuss natin what are the different like sample of progress notes. How do we make progress notes? That is your SOPI or SOPIER. Now, the third type of documentation system after source-oriented and problem-oriented, we have PIE. So pag PIE, we have problems, interventions, and evaluation. So it is a newer version that eliminates the subjective and objective cues. So PIE is a documentation model, groups information into three categories. So P is for problems, I is interventions, and E is for evaluation of nursing care. So ganun pa rin. So naiiba lang yung tawag. So problems, interventions, and evaluation. So yung nilalagay natin are just the same sa mga na-discuss natin kanina. So advantage ni PI eliminates the traditional care plan and incorporates an ongoing care plan to the progress note. Disadvantage, the nurse must review all of the nurse's notes before giving care to determine which problems are current and which interventions were effective. And then after PI, we have the fourth documentation system, the focus charting. Ito yung tinatawag nating FDAR. Focus charting. FDAR kasi meron siyang different components. No? So let's talk about FDAR or focus charting. It is intended to make the client and client concerns and strengths the focus of care. So again, ang focus of care natin dito is yung client concern or yung client problem, and then the strengths of the patient, pwede na siya maging focus of care. So meron tayong three columns here. You have the date, you have the date and time, you have the focus, and the progress. Okay, so again, you have the date, you have the focus, and then you have the progress notes. Sa progress notes, doon nakalagay yung DAR. Okay, si D, A, and R. So the focus may be a condition. Pag sinabing focus, ito siya. Yung date and time, definitely ito yung duty, tsaka yung time na nangyari yung mga bagay-bagay. So focus, this is your, pwede siyang condition, a nursing diagnosis, a behavior. Pwede rin signs and symptoms yung ilagay mo dyan, an acute change in the client's condition or a client's trend. So kayo yung mag-identify kung ano yung gusto nyong i-focus sa inyong patient. Base rito, pwede kayong mamili dyan. So that is the focus. And then yung progress notes, okay, are organized into DAR. Ito na yung data. D is for data, A is for action, R is for response, which refer to as DAR. Yung data, these are this category reflects the assessment phase of the nursing process. So ito yung assessment phase or yung mga subjective and objective cues or data na makukuha mo sa iyong pasyente. Okay, so ito yung subjective and objective. Action, ito naman yung gagawin mo or ginawa mo para ma-resolve yung data or yung assessment na nakuha mo dito. Okay? Yung problem, yun yung focus, ano, yung focus, ito yung concern mo. Ito yung gusto mong ma-address. Tapos yung data, ito yung nakuha mo based on your patient, based on your assessment. Actually, ito yung mga gagawin mo to solve definitely or to address the patient's needs. Yung response, definitely ito yung respond ni patient to the care that you have given. And this is the evaluation phase of the nursing process. So kita nyo guys, naiiba-iba lang yung tawag, naiiba lang yung format, nadadagdagan or nababawasan lang siya. Pero again, the nursing process is like, andun, yung concept is just the same. You assess, you identify the problem or you diagnose, you plan or identify your goals or desired outcome, give your nursing interventions, and then evaluate. So basically, dun lang siya umiikot. So ito yung mga advantages ni FDAR or focus charting. So it provides holistic perspective of the clients and the client's needs. It provides nursing process framework, and the three components do not need to be recorded in order, and each note does not need to have all three categories. So flow sheets and checklists are frequently used on the client's chart to record routine nursing tasks and assessment data. And then after focus charting or after, by the way guys, I have another, may yung video ko about focus charting, narrative charting, magkasama siya. So I can send that to you on how you can really write your own FDAR or narrative charting. And then last, I think this is the last, charting by exception. So charting by exception, it is a documentation system in which only abnormal or significant findings or exceptions to norms are recorded. So kung ano lang yung abnormal or yung significant na findings na nakita mo, yun lang yung chart mo. So CB incorporates three key elements. You have flow sheets, which includes the graphic records of a vital sign sheet or in TPR sheet na tinatawag, standards of nursing care, documentation by reference to the agency's printed standards of practice, eliminates much of the repetitive charting of routine care, and bedside access to chart formats, which all flow sheets are kept at the client's bedside to allow immediate recording and to eliminate the need to transcribe data from the nurse's worksheet to the permanent record. So, um, dito sa atin in our context, hindi masyadong popular itong sa charting by exception. Commonly, ang ginagamit sa atin in the context of the Philippines, we have the narrative charting for the traditional hospitals, and then CFDAR or focus charting. Yun yung common na pag-chart natin. So this is an example of a CBE, charting by exception, in an EHR. Okay? I mean, electronic health record. So dito guys, explain lang dito or so we're done with the documentation system. Ito kasi computerized documentation, this is like yung contemporary way of documenting. Yeah, it is also part pa rin siya ng documentation systems. Okay? And this is a contemporary way of documenting our care to our patient, and commonly sa ibang bansa talagang practice na to. And then they have yung mga developed countries, they have their nursing informatics already. So electronic health records are used to manage the huge volume of information required in contemporary health care. So the HR can integrate all pertinent client information into one record. Okay, nurses use computers to store the client's database, add new data, create and revise care plans, and document client progress. So, eto definitely, we use computer sa pagda-document. We use tablet, for example, iPad, sa pag-chart natin or sa pag the document ng mga nagawa nating care to our patient. So in some hospitals na technology-driven or medyo maganda yung kanilang facility, they are using this one, electronic health records. It entails cost kasi kapag gagamit ng computerized documentation such as EHR. So for the remaining slides, I just included here ano yung mga pros and cons of using the EHR. So I will leave the rest of the details to you guys for your additional reading. And then sa documentation system, this is part of na dapat alam nyo as a nurse, yung commonly used abbreviations. So we have already discussed this in our fundamental skills lab. So okay na to. I just included this one for your reference. And then ito yung mga official do not use list from the Joint Commission. So dinagdag ko lang din siya for your information. And then correcting a charting error. So it was already discussed then sa ating skills lab. And do's and don'ts in your documentation. So ayun, yung mga the rest of the slides na I showed to you, please read thoroughly na lang for, and then these are for your additional readings. Okay, so that concludes my discussion sa ating chapter 2 pa rin. Sub or subtopic is nursing as a science. So basically here I discussed the nursing process, which includes the assessment, diagnosis planning, intervention and evaluation, and then partly I also discussed the documentation systems. So I hope that you have learned something from this topic. Thank you and God bless.